Look, both Democrats and Republicans want to repeal the Affordable Care Act. The Democrats want to replace it with Medicare for all. And what people need to realize is that Medicare for all means less health care for seniors. It means taking away the health insurance you get through the job. It's going to be federal funding of abortions, and it's going to be the end of the Veterans Administration system as we know it as well. But instead, I think that there are so much better ways that we can replace it with. So number one, I want to make sure that we protect pre-existing conditions. And number two is I want to make healthcare more affordable. And we're going to do that by empowering patients, putting patients in control, creating competition, increasing transparency, and promoting innovation. So look, I'm a doctor. I want everybody to have healthcare, but it also has to be affordable.
I do. I mean, I was paying attention in 2009, and what went through. I mean, it was a bill. They said you gotta pass it, and then you can read it. It was rushed through. It passed with 86% Democrat support and 0% Republican support. So I'm a Republican, so I wouldn't have voted for it then, and I would certainly go for its repeal now.
I believe that everybody should be able to choose their own insurance company. We cannot force people with health care or anything else. It has to be a choice. And we can't shove it down their throats. The healthcare systems that we have in place in the United States are good healthcare systems. I don't want to see you get taxed because you didn't sign up for one. And then you've got a $500 tax or $1,000 tax waiting for you because you didn't do it. You should be able to do what you want. Everybody should. That's our free rights.
Yes, I do. I think, first of all, I'm not in favor of state single pay, state run healthcare. I think it ought to be market driven. Any healthcare program ought to be market driven. It ought to be transparent. It ought to be accessible to everyone, and it ought to be affordable to everyone. Currently, here's why I'm opposed to what we're doing currently. Right now, medical providers are working under a fee-for-service system. And what that means is that they get paid for providing services. What I would like to see us do and is have more of a patient outcome. In other words, medical providers are paid for performance. If they can get medical outcomes of the patient, then they ought to be rewarded for that. However, now, as it relates to a plan that I would be supportive of, I would want pre-existing conditions to be included in that. And that's part of what we have right now. So I would want that to be part of it. I also would want young people up to the age of 26 to be able to be under their parents' programs. And I also would like to have something called a right to try. If someone is in dire need from a medical standpoint, and they're willing, and maybe the prognosis is not very good for them, and they're willing to take an experimental drug or treatment, I think they ought to have the right to try.
Act introduced some important aspects of legislation in that my wife had cancer. We were both students. I didn't even have insurance, but before they had like out-of-pocket maximums and all of these sorts of, you can be on your parents' insurance, things like that. She had a 20% copay up to $100,000 they would max pay out. So her total treatment costs $400,000 to $500,000. And so at $100,000, we already were $20,000 in debt, and we couldn't even get them to do the surgery until we figured out something else. And so the type of like just awful and expensive care the insurance companies have, like, it is great that we have some protections against that, but I feel like it put this incredible, like, inefficient middleman in there of like, let's just dump millions and billions of dollars into private insurance companies when we could just cut them out. And so I support Medicare for all. I think it is It provides more competition because you go to any provider based on the quality of care rather than who got the best deal with your insurance company who tells you where to go. And with my wife's treatment, they were constantly denying random claims and getting billing, hospital, insurance, mail. When you're going through the worst time of your life, you want the peace of mind to know, it's covered, I don't have to sort that. And all of that billing and collections and things, that costs $80,000 to $100,000 per medical care provider. That is a huge efficiency gain off the top to just say, bye, most of you are done. And so what we've seen with over 80 studies of Medicare for All, it almost every single one shows we're going to have more care because more people are going to the doctor when they're sick instead of waiting till things get bad, but then at a lower total cost. And so I think that it provides more choice, more peace of mind, more treatment at a lower cost. And so I think ACA is put a few helpful protections, but the system with private insurance is not functional to keep costs or quality in line.